2019 was another fantastic year for Metro Charity. Though there have obviously been some key changes to how we deliver our services as we moved into 2020 and the beginning of the COVID-19 pandemic, you are going to see some of the highlights from 2019, demonstrating the diverse range of activities and services Metro delivers and the impact we have made. Our vision is for a world where diversity is celebrated, difference respected and valued, and where optimum health and well-being for all is a collective goal. In order to achieve this vision, we are informed by our 4 core values: innovation, insight, integrity, and investment. We provide services across the southeast of England: Essex, Kent, Medway, East Sussex, West Sussex and Surrey, as well as pan-London services. We also have a number of borough-specific services focused around South London. None of this would be possible without the hard work and dedication of our team. We have 103 staff and 74 volunteers who all work tirelessly to deliver our vital services. Metro continues to provide more services than ever before, to more people and with more impact. Over the course of the year, we have delivered over 218,000 occasions of service, all across our 5 domains: sexual and reproductive health, community, mental health and wellbeing, youth and HIV.
In sexual and reproductive health, we work to provide truly holistic, innovative, and responsive sexual and reproductive health services that are optimized for the different communities we serve. We provide community screening and testing, outreach, condom distribution, and contraceptive services that integrate behavioral interventions. We also provide a wide array of sexual health training and workshops. Our priorities for the year ahead are to increase the visibility of our services so that Metro is seen as a leading sexual and reproductive health provider in our key areas as well as beyond. We also want to secure non-statutory sources of income, particularly those generated by expanding our sexual and reproductive health training and sharing our expertise so that we remain flexible and responsive in a changing public health environment.
As an organisation, we are committed to community participation, involvement and engagement, and the work of the community domain is embedded across the charity's work to harness the power of community organising and community voice. We also provide person-centred support, advocacy and peer-led services, including hate crime, food inequalities and services for older LGBT+ people and disabled people. In the next year, our priorities are to further ensuring we are supporting the most deprived and disengaged and continuing to promote equality, diversity and co-production.
We work to provide holistic mental health and wellbeing services, combining treatment for psychological and emotional distress, both clinical and non-clinical, with interventions aimed at identifying and mitigating the cause of distress, as well as supporting individuals and communities to maintain and enhance their mental health and well-being, providing counselling, peer support, group work, advocacy and crisis work. Our priorities for the year ahead are to support LGBTQ+ children and young people and their increasing vulnerability to poor mental health during the COVID-19 pandemic, making sure our counselling and wellbeing services are delivered in ways that are accessible to children and young people, given the COVID-19 pandemic restrictions. We also want to develop and diversify our online adult counselling services offer as we adapt to the COVID-19 pandemic.
We work to empower and educate young people to reduce the escalation of current and future needs as they become adults. We acknowledge that young people face barriers and challenges which need to be overcome before they are able to access provision. We provide training to providers and run a suite of LGBT youth groups, groups for young people affected by HIV, and one-to-one mentoring for boys and young men, girls and young women, and trans and non-binary young people. Over the next year, our priorities are to increase youth participation and youth-led decision-making, and also to develop our online youth offer.
We work across HIV prevention and support, including testing, one-to-one and group behavioral change interventions, information campaigns, training, outreach, and condom distribution, as well as a holistic support for people living with HIV, including advice, advocacy, and family support. We aim for an integrated flow between testing, prevention, support, ensuring the moment of a positive or a negative diagnosis is not the end of the journey. Our priorities for the year ahead are to develop and diversify our online group work and mentoring support offer for the most vulnerable groups of people living with HIV who have been hit most by social isolation and COVID-19 pandemic lockdown measures. We also want to ensure that people have access to good sexual health and HIV information, testing, treatment, and prevention tools, ensuring that people are knowledgeable and can access the new national rollout of PrEP at a local level.
Metro continues to grow, with our income increasing year on year. Projected income of over $5 million for the financial year end 2021. Our expenditure across our 5 domains remained relatively consistent. In total, our expenditure was less than our income, which resulted in a surplus of £75,946. This aligns with our trustees' plan to continue to maintain reserves of 3 to 6 months of operating expenditure. You've heard the priorities for the year ahead from each of our delivery domains. We also have priorities across our core areas: communications policy and research, fundraising, HR and volunteering, governance, and finance and premises. We cannot deliver our vital work without our individual and corporate supporters, funders, and commissioners. Your money and support is invested directly in activity that makes a positive and lasting difference to the lives of the people we work with.